Hello and welcome to the Golden Canopy Health Management channel, where we are dedicated to ensuring health, enriching life, and embracing retirement. My name is Kevin Lee, one word like heavenly, and today we're going to talk about a very complicated and confusing topic, which is called enrollment period. And that'll be a two-part video series as to what is enrollment, why does it matter, when does it apply, and that'll be the point and topic of today's video. We'll also talk about why partnering with Golden Canopy Health Management can help navigate the jungles of what is called Medicare. So let's go ahead and dive on in. When it comes to open enrollments or enrollment periods, should I say, there are 5 different enrollment periods that we all need to be aware of. And because they're all complicated, they're all different times, we have dates that overlap, we have dates that coincide. It's important to have someone that you can trust to walk you through and navigate through that process. So we'll take them in turn. They'll be brief, but my goal is to help you understand when you should be signing up, keeping an ear out, keeping an eye out, when you should be looking at enrolling for your Medicare benefits. The first one is called IEP, which stands for Initial Enrollment Period. The initial enrollment period for someone who is about to turn 65 years of age is 7 whole months. So how it breaks down is 3 months prior to your 65th birthday, your birthday month, and 3 months after you turn 65 is considered your IEP, which is Initial Enrollment Period. Initial Enrollment Period, which states that those who are, for the first time, signing up or getting into the Medicare program, that is your window. 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday is your IEP, Initial Enrollment Period. Now, because we don't all have the same birthdays, your IEP is different for everyone else. So if you are confused when that happens, it's simply 3 months prior to your 65th birthday, your birthday month, and 3 months after. How do you sign up? You can reach out to Golden Canopy Health Management, and we will, 1, go over your options, 2, share with you your benefits, and 3, and sign up with you or for you for Medicare. Of course, you can also go to the SSA website, which is Social Security's Administration. And a lot of times, if you're about to turn 65 and you've met the requirements for eligibility, you will automatically get your Part A card in the mail. So that is the first enrollment period, which is IEP, which means Initial Enrollment Period. In my next video, I'll go over that and when it happens. The second one is called GEP, which is General Enrollment Period. And the General Enrollment Period is from January 1st to March 31st each year. Your General Enrollment Period is for those of you who may have missed your open enrollment period. This is like another chance for you to again, sign up for your Medicare. In the next video, I'll explain why each date is important to you, and you'll be able to know which ones correspond better with your needs when those dates come. So IEP, Initial Enrollment Period, is a period of 7 months, 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. The next one is GEP, General Enrollment Period, and that goes from January 1st to March 31st each year. And that program covers Part A and Part B. And you can sign up by reaching out to Golden Canopy Health Management, or you can go to the Social Security Administration website as well to also sign up for through general enrollment period. The third option is MAOEP, which stands for Medicare Advantage Open Enrollment Period. I have yet created videos to break down what Part A, B, C, D is, but open enrollment period for Medicare Advantage is also January 1st to March 31st. So those will be one of the options that'll be available to you when you are initially getting into Medicare. And if you miss that window, that window's open for you January 1st through March 31st. You can, once again, go through Golden Canopy to sign up for your Medicare needs. Like you said, one of our experts will go with you over the options so you can see what is available to you. We want to custom make, tailor-made your policy so it fits your needs, your wants, your desires, and we can help you enroll into your Medicare plan as well. The next one is AEP, which is, I feel like that's one we're all familiar with. During that time frame, there are going to be so many commercials on TV, on the radio, on Facebook, on Twitter, on YouTube, that it is very overwhelming, and I'm sure you're aware that time happens from October 15th through December 7th. Like I said, in the next video, I'll explain to you why and how each of these apply to you. But that is the fourth enrollment period. So one more time, number one is IEP, which is initial enrollment period, and that is a period of 7 months. 3 months before you turn 65, the month you turn 65, and 3 months after. Option two is GEP, which is general enrollment period. If you happen to miss your own personal enrollment period, you can sign up for Medicare then. There is a penalty fee if you are late for during your IEP, so be aware of that. The third option is MAOEP, which is Medicare Advantage Open Enrollment Period, and the General Enrollment Period and the Medicare Advantage Open Enrollment Period goes from January 1st to March 31st. And then option four is your Annual Enrollment Period, and that goes from October 15th through December 7th each year. And that's when all the commercials are bombarding you, all the phone calls happen. If you want to avoid all of that, if you want to avoid all the confusion, reach out to Golden Canopy. We'd love to be the consultants that you talk to, work with, and of course, remember that there's no cost to you for consulting with Golden Canopy Health Management. We'd love to help you, even if you're in a plan and you just want to just get a second or third opinion about the policy or plan that you're on. We'd love to help you with that as well. And the fifth and final open enrollment period is called SEP, which stands for Special Enrollment Period. The special enrollment period can happen at any time. Based on the name, something special has to happen, getting married or moving to a new location. I'll go into more in depth as my part 2 of open enrollment video comes out. But those are the 5 open enrollment periods you need to know and be aware of. The first is the IEP, Initial Enrollment Period. The second is the GEP, General Enrollment Period. Third is MAOEP, Medicare Advantage Open Enrollment Period. The AEP, Annual Election Period. And number 5, SEP, Special Enrollment Period. Please reach out to Golden Canopy Health Management. I have all the information in the link below. If you have any questions, concerns, please please subscribe, please hit the notification so you will never miss when a new video with exciting content about Medicare to empower you comes out. Once again, my name is Kevin Lee. Thank you so much for stopping by, and I'm looking forward to hearing from you guys. Bye-bye.